Dr. Craig Mamitele. I'm one of the urologists here at Botshilu Hospital. We're going to talk about the prostate gland. Prostate gland is one of the male sexual organs which are found internally. On the outside in a male, we know that there's a penis and a scrotum. On the inside, there are other male accessory sexual organs. One of them is the prostate. So all men should have a prostate. There are a couple of things which happen in a male as they get older and older. So the prostate gland, it sits just below the bladder. It is this organ. So with the prostate, as you get older and older, it starts getting bigger and bigger. As it gets bigger and bigger, it will start causing certain things that you're gonna notice, especially when you urinate. Because when you urinate, urine has to go through the prostate from the bladder to go to the outside. So as it gets bigger, it closes the channel for urinating. One of the symptoms that you're gonna see is that all of a sudden you can't do things that you could do when you were young, like urinating over the wall, that you urine to go over the wall or go very far. As you get older and older, you lose the ability to do that because the bladder outlet is starting to get restricted. As you get older and older, the number of times you go to the toilet, it also increases. It's because your bladder doesn't empty fully. All of a sudden you start waking up 2-3 times at night, even when you didn't drink a lot of fluid. When you urinate, you have to push or strain a bit so that the urine comes out. After urinating, feeling that the bladder is not properly empty. Or when you start seeing dribbling, which stains your underwear or your trouser after urinating. Or you can get hesitancy. It's when you want to urinate, you have to wait a bit, almost like you're begging urine to come out. These are some of the things which happen as you get older and older. This is normal evolution of the body. So as you get older and older, the prostate, this part of the prostate, it's gonna get big and it will start closing this outlet. The three main conditions which happen in the prostate, the first one is what we were talking about, the normal enlargement with age. As it enlarges, it tends to get infections. So if you're a man and you end up getting infections, or one of the healthcare workers sees you and they diagnose you with a urinary tract infection, it's a call for concern. It can either mean that your prostate is starting to block the urine outlet and then you end up with infection. That, if you're not urinating well as well, you can end up with what we call bladder stones, with concentrated urine staying much longer in the bladder and end up causing a bladder stone with concentrated solids in there. Another problem that we see with the prostate is prostate cancer. When we're talking about cancer, we're talking about the small part of the prostate which starts growing uncontrollably, not listening to the signals around the prostate. It can start as a small thing and end up spreading around the prostate, or a small thing spreading around the prostate, and then later on it starts metastasizing or spreading throughout the whole body. That's when we've missed the boat. So when you get to around the age of 40, we start doing what we call screening. We look for risk factors or the possibilities of you getting prostate cancer, so that we can diagnose and plan treatment while it's still inside the prostate. We have a couple of interventions that we can do when the prostate cancer is still inside the prostate. We can either remove the whole prostate or do radiation. But if the cancer has gone outside the prostate or they spread throughout the body, we'll have to do a couple of things. Basically, it's not to cure, it's just to control the aggressiveness of the cancer and to control the symptoms. But to cure you when it is outside the prostate is a bit difficult. So in terms of urology guidelines, if your father or any of your family members have had cancer, from the age of 35 to 40, you can start screening for prostate cancer. So screening, it will entail either we do blood test and a rectal exam. If we worried, then we're gonna monitor you very closely. We may even monitor you once annually or twice annually. But if your risk factors are very low, we can see you once in every 2 years, and then that will be able to comfortably tell you and reassure you if cancer is not a possibility in your case. But if your possibility is high, we'll end up taking you to theater, do a biopsy and confirm if there's cancer, and then we can plan for treatment. Thank you.